Good afternoon/evening, everyone. How are you? I'm Steve Lookner here from Right Side Broadcasting Studios in Auburn, Alabama. We wanted to come on live because there was some breaking news late this afternoon/early this evening. The GOP, the House Republicans, released their version of the Obamacare replacement bill. It's called, let's see if I have this right. I believe it's called the American Health Care Act. Do I have their right? Well, let me confirm that here. The American Health Care Act, that's what it's called. They actually released the text of the bill today. You can go online and get it, I believe at house.gov. Let me get you, I won't read out the whole link, but let me just see here if I can find a quick link to give you. Anyways, so I saw a bunch of links. If you go on say Twitter and you search House Obamacare replacement bill text, you should find it. But the thing is, the bill itself, I looked at it a few minutes ago and I did some skimming through it. It's kind of technical, legalistic language, and I really need to kind of sit with it for longer to really see all what's in there. But we wanted to come on and give you some coverage of it anyway. Also because we want to do this because the House actually released like a 2-page summary kind of thing about the bill that just came out. And so this is really the first concrete stuff we've had about this bill. Oh, and Jake, by the way, if you can hear me out there, is it possible to turn me down? I'm hearing myself out there a bit through the door. Thank you. So this is really the first concrete detail we've had on this plan that Congress has to repeal and replace Obamacare. Now, we have this is the House version of the bill. The Senate might have a different version. Maybe this House version will be modified some, I don't know. But this at least is the first detail we have. So let me first read you. This is the 2-page summary that the House just put out about this bill. I'm going to read it to you. This is available online too. You can find it. It's called House Republicans Deliver on President Trump's Health Care Promise. I found this at waysandmeans.house.gov. And if you go there, there's a link to this, waysandmeans.house.gov. So let me just read. It's a short summary and highlight certain points from this new House GOP healthcare bill to repeal and replace Obamacare, the Obamacare replacement bill that has just come out a few minutes ago. So here's what the House Republicans say in their summary of this bill. Obamacare is hurting more people than it is helping, forcing Americans to buy insurance they don't like, don't need, and cannot afford. Premiums have increased by an average of 25% this year. Nearly 1/3 of all U.S. counties have only one insurer offering plans on their site's exchange. 34% fewer doctors and other healthcare providers accept Obamacare insurance compared to private insurance. President Trump called on Congress to act decisively to rescue Americans from his failing law, and House Republicans are answering his call. More than 8 months ago, we outlined our version for repealing and replacing Obamacare in a better way. Since then, we have been talking with our constituents and colleagues about how to turn these solutions into policies that will improve lives. Now, House Republicans are moving forward with fiscally responsible legislation to deliver relief from Obamacare's taxes and mandates and lay the groundwork for a 21st century healthcare system. Specifically, the primary committees with jurisdiction over healthcare, Ways and Means, and Energy and Commerce have released the American Health Care Act, legislation that not only repeals the law, but replaces it with reforms President Trump laid out. Taken together, here's what the American Health Care Act will do. Deliver relief. Dismantle the Obamacare taxes. Under deliver relief, there are 2 bullet points. Bullet point 1. Dismantle the Obamacare taxes that have hurt job creators, increased premium costs, and limited options for patients and healthcare providers, including taxes on prescription drugs, over-the-counter medications, health insurance premiums, and medical devices. Bullet point 2. Eliminate the individual and employer mandate penalties, which forced millions of workers, families, and job creators into expensive, inadequate Obamacare plans that they don't want and cannot afford. Major point 2, preserve vital patient protections. Bullet point 1 of this. Prohibit health insurers from denying coverage or charging more money to patients based on pre-existing conditions. Bullet point 2. Help young adults access health insurance and stabilize the marketplace by allowing dependents to continue staying on their parents' plan until they are 26. Main section 3, the final main section. Advance 21st century reforms proposed by President Trump. Bullet point 1. Establish a patient and state stability fund which provides states with $100 billion to design programs that meet the unique needs of their patient populations and help low-income Americans afford health care. Bullet point 2. Modernize and strengthen Medicaid by transitioning to a per capita allotment so states can better serve the patients most in need. Bullet point 3. Empower individuals and families to spend their health care dollars the way they want and need by enhancing and expanding health savings accounts, HSAs, nearly doubling the amount of money people can contribute and broadening how people can use it. Bullet point 4. Help Americans access affordable, quality health care by providing a monthly tax credit between $2,000 and $14,000 a year for low and middle income individuals and families who don't receive insurance through work or a government program. Final section is this. As President Trump said during his joint address, action is not a choice, it is a necessity. House Republicans are taking action this month to provide relief and deliver patient-centered health care. Okay, so that is the 2-page summary of the Obamacare replacement bill that was just released a few minutes ago by the House. This is the House version, a House GOP version of the Obamacare replacement bill. This is the 2-page summary that was released. The whole bill was released. However, it is long and it is also kind of in very legalistic legislative terminology. So I obviously could not digest all of that before I came on with you, but I wanted to come on with you. We want to do some coverage of this. So just read the summary, and real quick, I want to just go back over just a couple of the key points here. So one point I noticed in this summary of some of the things that the bill does. One point was eliminate the individual and employer mandate penalties. So what that means in part is that you no longer will be penalized for not buying health care. Remember, one thing Obamacare did is it put into place these penalties that said if you're an individual and you don't have health insurance, you get penalized. So this bill will eliminate the individual employer mandate penalties. So the individual one was on individuals. I believe the employer mandate one, and I'm sorry for not having this on top of my head, is something like if employers don't offer health insurance to their workers of a certain type, they get penalized too. So that penalty is eliminated. But the one thing the point I wanted to focus on here was individual mandate gone if this bill passes. So that's one thing. Another thing I saw was this monthly tax credit thing. So one of the things mentioned was help Americans access affordable quality health care by providing a monthly tax credit between $2,000 and $14,000 a year for low and middle income individuals and families who don't receive insurance through work or a government program. So there's something, I'm assuming what this is related to is that what this might be is that, you know how now with Obamacare, if you want to get health insurance, if you are under a certain income level, you can go on the Obamacare, on these health insurance exchanges and find a plan, but you get subsidized if you're low income to buy a plan. It depends on how much subsidy you get. Depends on how your income is, how high your income is, or how low your income is. And here we have talk of a monthly tax credit between $2,000 and $14,000 a year for individuals and families who don't receive insurance through work or a government program. Now, it sounds to me from this like this is different from a health insurance subsidy, because a health insurance subsidy would only be like, if you buy your insurance, we'll help you out with it. Whereas a tax credit seems to be, we're just going to give you this tax credit if you're low or middle income individual and a family and you don't receive insurance through work or a government program. So if you don't have health insurance through work or a government program, you'll get this tax credit, but you don't need to use the tax credit to buy health insurance. How you use the tax credit is up to you. Maybe you put it all towards Plan X or Plan Y, or to not all of it towards a plan or none of it toward a plan. At least from what I'm seeing here, it sounds like this could be different. It's not a subsidy for health insurance. It's just a tax credit you get, and it's up to you. And that would make sense, because if this bill isn't requiring you to have health insurance, then it would seem that you could get your tax credit and not spend it on health insurance if you didn't want to get health insurance. I'm not advising you do that, but I'm just saying that that is something I had heard that this bill was going to do. It was going to shift from subsidizing health insurance purchases to giving tax credits. Something else I'm wondering about here is how high an income are we talking about here? Because there was talk that the Republicans were concerned about middle-class people who made enough so that they didn't qualify for health insurance subsidies, but were still having to buy health insurance, and they were paying a lot out of pocket for these health insurance plans and wanting to help them some. So a question I have about this proposed tax credit, and I'm guessing it might be in the bill somewhere, the exact income levels, is it possible that people who didn't qualify for health insurance subsidies under Obamacare actually do qualify for a tax credit under this plan? I'm not sure. Question I'm wondering about. Couple other important things from these bullet points laid out in this GOP summary of their health care bill that they're proposing. There will not, it says, prohibit health insurers from denying coverage or charging more money to patients based on pre-existing conditions. So that's a key point. A number of people who've been worried about the repeal and replace Obamacare thing have worried that whatever the replacement was not going to have any protection, and it would go back to the way it used to be, which is that health insurers could charge more or deny coverage if somebody had a pre-existing condition. So let's say you have some sort of cancer, and you got fired from your job and you lost your health insurance from that. In the past, if you wanted to go buy health insurance, you might not get offered any policies or get offered an extremely, extremely high-priced policy because you have this pre-existing condition. That was changed under Obamacare, and this summary says that in this replacement bill, health insurers will not be able to deny coverage or charge more money to patients based on pre-existing conditions. So that's an interesting thing in this healthcare replacement bill that's being proposed. That obviously will cost more money, because I'm guessing, to make the bill cost more. We'll see what happens. Another interesting point from this summary was the one about young adults. So this point was allowing dependents to continue staying on their parents' plan until they are 26. That was something that came into being with Obamacare, if my memory serves me right. And this would be another part of Obamacare that is kept by this new House proposed Obamacare replacement bill. So we have some summaries. Obviously, there's some devil in the details stuff. Well, obviously, there's a lot more detail than the two-page summary. And I'm sure a big question that will be coming out about this bill is how much will it cost? How much will it cost? And how do we pay for it? So this is an obvious issue. So one question that's come up with this replacement bill is, if you're going to keep some of the things that people like from Obamacare, that certain people like the insurers can't charge more or deny coverage for pre-existing conditions, or young people can stay on their parents' health care until they're 26, those kind of things, it's going to be the plan that will add to the price of the plan. And the question is, can the Republicans find an Obamacare replacement that either gives at least as good care or better care to people, but doesn't break the bank? We'll see what happens. I'm sure all this will be discussed in the next couple of days. So that for now is just, I wanted to first read you the summary of the bill that the House put out and have you know that that's their summary. If you want to find that, again, if you go to waysandmeans.house.gov, you can find the summary of the bill. Also, if you want to write in at all and offer any comments. So I also heard, what did I hear? Sean Spicer in his press, it was either in his press gaggle or his remarks at the White House, on the front of the White House, he gave a few remarks on camera today. And one of those two, he said that by Easter recess, the goal was to have the health care stuff done in Congress, to have the repeal and the replacement voted on in Congress. So All this is going to need to move pretty fast if that's going to get done. So we're definitely going to be hearing more about this. If you have any thoughts on either this House replacement bill that's being proposed or just the healthcare situation in general, would love to hear them while we're on the air here. You can comment, send in your comment or your question. The information's on the screen right now. My Twitter is @Lookner, @LOOKNER. You can send me a comment there, or you can email me at steve.lookner@rsbn.tv. Also, I just wanted to check real quick. There were some people who had tweeted about this, and I wanted to check that because there might be some genius people there who've gone through the bill already and caught some things. So I just want to also remember, what did they call this? The American Health Care Act. So I'm just searching that on Twitter to see if any interesting tweets have come up while we've been on the air here. So an NPR tweet summarized it as follows. It says, the bill is called the American Health Care Act. It would eliminate the mandate that all Americans have health insurance. That certainly it does, according to the House. Let's see here. Let's see. Oh, okay. So this is a post from Vox. And what Vox says, these are some points Vox highlights. Vox says that this bill will allow Medicaid expansion to continue. This plan says that the states can continue enrolling people under the Medicaid expansion through January 1st, 2020. At that point, enrollment would freeze and states could no longer add to the rolls. Legislators expect that enrollment would shrink as enrollees' incomes change, and people fall off the rolls. So this was a point of contention. This has been a point of contention. Part of Obamacare was that it expanded the number of people who would be covered under Medicaid. And according to Vox, who apparently has read through this bill, they have found a part where it says, the states can continue enrolling people under the expanded Medicaid through 2020, January 1st. At that point, enrollment would freeze, which suggests to me, it sounds something like, if Vox is correct, that the bill is keeping the expanded Medicaid for about 4 more years and then stopping, and I guess maybe the expansion of Medicaid would stop then and would go back to the way it was. So that would be kind of like a compromise thing if that's true. Like, well, we're not going to immediately eliminate the Medicaid expansion under Obamacare. We're going to keep it for a few more years, but then we're going to eliminate it. So that's one thing. Another thing the Vox says is that this bill would include age-based tax credits for those who earn less than $75,000 or $150,000 for joint filers. And the tax credits would depend on how old you are, how much tax credit you get. And then also, it does not another thing that Vox mentions is it does not cap the tax on employer-sponsored coverage. Previous drafts of the plan would have taxed especially high-cost insurance provided at work. This new plan does not include that provision and instead continues the taxes in Obamacare for an additional year to pay for the continued Medicaid expansion and individual market tax credits. So those are 3 points that Vox saw in the bill that they thought were relevant. And if you want to see that tweet that I just read some of to you, go to vox.com, @vox.com, and you can read it there. Let's see here. So, I'll just say, we wanted to come on today and report about this because it just happened. But I am sorry, in a perfect world, I would be like a genius robot, and I could have digested this whole bill. I think it's about 30, 40 pages long, and all in this complicated language. I could have digested it and told you exactly what's in it. But we thought it was important, given that it was just released, to at least come on, do some breaking news coverage, give you a summary of some key points in it. And I'm sure, later tonight or tomorrow you'll be reading about it, and we can come on and do more coverage if more stuff comes up about this. But we thought it was important to do some breaking news coverage about it. But just know that we apologize. We don't have everything on the bill. It's not all in my head right now. Look at the bill. I think you'll see why I could not get all the stuff from the bill in my head in my 10 minutes. Anyways. So this is from Bougro. Steve, a tax credit is a tax incentive which allows certain taxpayers to subtract the amount of the credit they have accrued from the total they owe the state. Yeah, so you're saying they get it. So you're saying, technically speaking, a tax incentive, Boog, you're saying it allows certain taxpayers to subtract the amount of credit that they have, to subtract how much they owe the state or owe the federal government. Now, I might have been saying it as they'll give you money. To me, it's the same kind of thing because If you subtract a certain amount you would have owed on your taxes, you have that much more money. So you're correct in that, like, they're not sending you a check if they're giving you a tax credit. If they're that allowing you to deduct money would not be allowing you to deduct how much you owe in taxes is not sending you a check. At the same time, the effect is the same, that it gives you more money than you would have had otherwise. But thank you, Boog, for writing that in. I appreciate it. And let's see if anything else is up here. Sorry. KTYG says, like it so far. Okay. And so I think, the takeaway here is that we have this bill released, and the bill does there have been a bunch of rumors in the last few days about what the GOP would have in their health Obamacare replacement bill. There doesn't seem to, the stuff I've been seeing so far in the bill seems like stuff I saw talked about in the last, week or two in articles that had come out. So I think, some of the fights about this are going to be, some of the big fights, as I said before, are going to be like, how much is this going to cost? Is it realistic? Do we have enough to pay for it? Where is that money coming from? And I'm guessing you will see a lot of debate about that over the next couple weeks, next month. We'll see. So that's about the state of things. So right now I want to say also, I want to get you, if you want to actually read the bill yourself, where you can... Jamie Dupree, by the way, who I follow, says, the 40% Cadillac tax on more expensive health plans is delayed from 2020 to 2025, but not repealed. That's what Jamie Dupree says about this. And hold on. Let me see if I can get you this bill. I'm going to get you a link before we go off here. Before we, here we go. That's the fact sheet. I had it, guys, before I came on. All right, last thing. This is exciting TV when you watch me search, but I'm doing it for you. So we'll do replacement bill text and see if that comes up. And I can tell you exactly where to go and find it. Here it is, got it. So if you go to energycommerce.house.gov, energycommerce.house.gov, that's where I am, that's where I'm getting this at. And I can't give you the whole, hold on, let me see if I can give you the whole thing here. Copy. Compose. I'm going to read it to you as a public service. I got it. Okay, I'm going to read this to you. energycommerce.house.gov/sites/republicans.house.gov/AmericanHealthCareAct.pdf. That's where to get the entire bill. You can get the whole text of the bill and you can read it. I'm guessing if you went to energycommerce.house.gov, there'd be some kind of link there, so you can look at that for yourself. So anyways, that's our summary of what's going on with this new bill. It just came out. We talked about a few bullet points from the bill. I'm sure more people will be reading, the press will all be reading, and experts will be reading over the bill tonight, pulling out certain things from it and saying, here's what it says. So you can go online, you can read the full bill. You can read the 2-page fact sheet, which the House GOP posted as well. And we will be, in the next couple weeks, definitely covering this bill, what happens to it. It's going to be debated, I'm sure, very loudly. I'm sure you're going to hear Democrats have some strong opinions on it. Will they pass this replacement to Obamacare? This is really big. If Congress repeals and replaces Obamacare, that's a big deal. I mean, if there's no more individual mandate to buy health insurance, that's a really big deal. I had heard today some Republican senators were wavering depending on what's in the bill. So we'll have to see how that happens. Will the Senate go along with the House? If the House votes for it, will the Senate vote for it as well? We'll just have to see. Anyways, just so for the future, if you want to follow our future breaking news coverage on this or other events that happen, subscribe to Right Side Broadcasting on YouTube. and click the bell, the notifications bell, and you will hear immediately about any of our videos that are about to happen. I'm at Steve Lookner. You can follow me at Lookner, at Lookner, and I always tweet out when I'm about to cover breaking news. And you can also follow at RSB Network. That's Right Side Broadcasting, and you'll get all the updates from Right Side Broadcasting at RSB Network. Thanks to the moderators for moderating another chat. We were on today. If you haven't seen it, we did a bunch of coverage today on the new travel ban. There's a whole video up where we have the press conference and the travel ban. And then we also have a video of the press conference plus about an hour of coverage we did after the press conference talking about the travel ban. So you can go watch that. You can also, when you're done watching this, Nick Fuentes is live at Right Side Broadcasting. So you can watch Nick Fuentes, his show. And and also, just we like to say here, we love bringing you this kind of coverage, giving you an alternate to the mainstream media, coverage of breaking news, coverage of live events. But to do so costs money, and we don't take money from big donors. We don't want them to control what we have to say. So if you enjoy our coverage and want to support us, we'd really appreciate any kind of donation you can give us. And donation's really easy to give. If you're watching on YouTube, in the YouTube chat, there's a $ sign at the bottom. Just clicking it. You can give big amount, small amount, we don't care. Just it means a lot to us that you just give and help us stay in business. Or you can go to rsbn.tv/donate. So anyways, that was our breaking news update about the healthcare bill that was released, proposed Obamacare replacement bill that was just released tonight by the House GOP. Right now I'm going to go outside and I'm going to read some more about it so I can learn more about what's in this bill. But for now, you can watch Nick Fuentes right here at Right Side Broadcasting. You just got to go search it go to the YouTube channel, Right Side Broadcasting on YouTube. You can find a Nick Fuentes show there. And we will be back as there's more news coming out. We will be back to bring it to you. So for now, from Auburn, Alabama, I'm Steve Lookner for Right Side Broadcasting. Have a great night.